This is a demonstration of the Medicaid and CHIP Quality Rating System Prototype A. The prototype illustrates the proposed requirements in the 2023 Medicaid Managed Care Rule related to the Medicaid and CHIP Quality Rating System website display. These requirements were informed by extensive consultation with beneficiaries and their caregivers through iterative testing of potential website content and with states through listening sessions and work groups. You can read a detailed account of this beneficiary feedback in the preamble of the proposed rule in the section called MAC QRS Website Display. CMS is proposing to implement the website display requirements in two phases. In the first phase, each state would need to develop a MAC QRS website, display quality ratings, and ensure that the user can access information on plan providers, drug coverage, and view quality ratings by sex, race, ethnicity, and dual eligibility status. Prototype A is designed to be one example of how states could implement the proposed first phase of website display requirements through a simple, static web page with links out to additional plan information. Keep in mind that states may choose to implement a more sophisticated website in the initial phase of implementation, so long as that website includes at least the display requirements required to be implemented during the initial phase. Please view Prototype B and the associated demonstration to learn more about the more interactive features we are proposing to require in a second phase of MAC QRS website implementation. The proposed requirements for the MAC QRS website would be found in Title 42, Part 438, Section 520 of the Code of Federal Regulations, or CFR. Throughout the demonstration, we use a red cursor to highlight the design elements in Prototype A that correspond to the design elements used in the Prototype A PDF. The design element numbers identify where in the prototype an example of a proposed website display requirement can be seen. These design elements also correspond to the citation map, which links each design element to the proposed requirements in 438.520 and provides the page number of the prototypes where the element can be found. Both of these resources are located on the MAC QRS website on Medicaid.gov. We propose several requirements to help website users navigate and understand the contents of the MAC QRS website. In this prototype, we have made a number of these requirements immediately visible on the MAC QRS landing page to quickly orient the users. The first of these requirements is a statement of purpose for the MAC QRS. In this prototype, the purpose of the quality rating system is clearly stated in 4 bullet points prominently displayed at the top of the landing page. Second, we propose to require that relevant information on Medicaid, CHIP, and Medicare is provided. There are 2 boxes on the right side of the landing page that refer the user to more information about Medicaid and CHIP if they need it. In this prototype, we chose to provide information on dual eligibility with Medicare in a different section of the landing page when it may be more helpful to the user. The first box links the user to information on Medicaid and CHIP eligibility. We also propose to require information or hyperlinks directing users to resources on how and where to apply for Medicaid and enroll in a Medicaid or CHIP plan. The second box on the right side of the landing page directs the user to resources on how and where to apply for Medicaid or CHIP. Additionally, we propose to require an overview of how to use the information available in the MAC QRS website display to select a quality managed care plan. This prototype uses a stepwise approach to provide an overview of how to use the website to select a quality plan. The bullets at the top of the landing page provide a preview of 5 steps that users are walked through on the landing page, ending with a button that directs them to the website where they may enroll in the plan of their choice. Each step is clearly numbered and described. These steps guide the user to compare plans on various dimensions such as covered benefits, costs, available doctors, medications, and quality of care, including experiences of current Medicaid plan members. Our proposal would require states to provide information on how to access the beneficiary support system to answer questions about using the MAC QRS. At the top of the landing page, a toll-free number for the beneficiary support system is shown. States could use the existing beneficiary support system described in Title 42, Part 438, Section 71 of the Code of Federal Regulations to comply with this requirement. We also propose the display of certain information that allows beneficiaries to identify managed care plans available to them that align with their coverage needs and preferences. First, we propose to require information that would allow users to identify all available managed care programs and plans they may be eligible for based on geographic location, age, and duly eligible status. In our prototype, Step 1 directs users to find the Medicaid managed care plans that are available based on their geographic location, which they can do by clicking on the health plan map on the left side of the screen. In this example, we see that there are 3 districts on the map, and each district has different plans available. Acme Health is available in all 3 districts. Blue Ribbon is not available in District C, and Prime Health is not available in District A. A description of the population served by each plan, including age and duly eligible status, is shown for each plan, helping users further identify plans that may be available to them based on age and duly eligible status. States could choose to allow users to select other eligibility factors the state uses beyond those shown here. Next, we return to the landing page and scroll down to Step 2. In Step 2, the user is encouraged to check providers and drugs that are covered by each plan. We also propose to require a description of the drug coverage and provider directory information for each managed care plan. In our prototype, users can access this information for each plan clicking on the 2 links provided under each plan name. The first link allows users to check the plan's provider directory to see if the plan covers doctors or other providers they are interested in. Under our proposal, this information must include at least all the information already required under Managed Care Regulations at 438.10 H1 and 2. The user can also click on the second link to see a description of the drug coverage for each managed care plan. Under our proposal, this information would include at least the formulary information already specified in existing 438.10.1. States are currently required to ensure that beneficiaries have access to both provider directory and formulary information and could choose to link to existing resources with this information from the MAC QRS website to meet these requirements. This would help create a one-stop shop for beneficiaries choosing a plan. We also propose a list of standardized information that states would display to allow users to compare available managed care plans on covered services, extra benefits, costs, and other metrics of managed care plan performance. In Step 3 of the prototype, 4 buttons are provided that allow the user to link to this information. Let's explore each component. We propose to require states to display a summary of benefits, including differences in benefits among available managed care plans within a single program. By clicking on the Covered Services button, the user can see a list of services that are covered by all plans. Next, we return to the landing page and click on the Extra Benefits button. This takes the user to a table summarizing the extra benefits offered by each plan. Extra benefits are free services covered by plans in addition to services that must be covered by all plans and are sometimes called value-added services. In most states, extra benefits will be the benefits or services that will be different from plan to plan. This table allows the user to easily identify the differences. We also propose to include the name of each managed care plan and a hyperlink to each managed care plan's website. This table includes the name of each managed care plan, as well as the website and telephone number of each plan. Next, we return to the landing page. We are also proposing that states would be required to display premium and cost sharing information, including differences in premium and cost sharing among available managed care plans within a single program. The Cost of Covered Services button takes the user to a table that displays premium and cost sharing information. The table shows differences in the costs among managed care plans available to the user. Similar to the previous table, this table allows the user to easily identify the differences in premium and cost sharing for covered services among plans available to them. Next, we return to the landing page. We are proposing that states would be required to display certain metrics of managed care performance specified by CMS that are already available to the public, including the most recent data reported to CMS in the Managed Care Program Annual Report under existing 438-66E, including the results of the Secret Shopper Survey that is also being proposed in this Managed Care Rule at 438-68F. The Provider Access button links to this additional managed care plan performance information that is already publicly available or proposed to be available through reporting to CMS. In step 4, the user can compare quality ratings for each health plan. Quality ratings are at the heart of the QRS, and we learned a lot about what is important to beneficiaries and how they use the ratings to choose a plan. Our proposed provisions would require states to display quality ratings for mandatory measures identified by CMS and to stratify certain mandatory measures identified by CMS by dual eligibility status, race, ethnicity, and sex. In step 4 of the prototype, 5 buttons are provided that allow the user to view each of the 3 plans' quality ratings for mandatory measures and view the quality ratings for each of the plans stratified by dual eligibility status, race, ethnicity, and sex. The first button links to child and adolescent measures, and the second button links to adult measures. These links take the user to the quality ratings calculated by the state for each managed care plan for mandatory measures identified by CMS. We also see 3 buttons that allow the user to link to measures displayed by sex, race, and ethnicity of plan enrollees and dual eligibility status. Now, we click on the Adult Measures button. This page shows how the plan performs on a wide range of adult quality measures. The measures are organized into groups using different topics, which we call domains. The domains used in this prototype are behavioral health and substance use, chronic conditions, home and community-based services, preventative care, and member experience with plan. However, we emphasize that our proposal does not identify mandatory domains that states must use. We propose to require states to include an indication if a plan offers an integrated Medicare/Medicaid plan and link to the integrated plan's most recent rating under the Medicare Advantage 5-star rating system. In our prototype, Acme Health is for those who are duly eligible for Medicare and Medicaid, and therefore a link to the plan's 5-star rating for Medicare services is provided along with the required indication. We also propose several requirements to promote beneficiary understanding of and trust in the ratings. First, we propose to require a plain language description of the importance of each performance measure assigned a quality rating. In our prototype, each of the quality measures are followed by a definition and a plain language description of its importance. Second, we propose to require states to display the measurement period during which the data used to calculate the displayed quality rating was produced, and we propose that information on quality ratings data validation, including a plain language description of when, how, and by whom the data were validated, must also be displayed. At the top of the display, there are two notices that provide this information. The first notice is the measurement period during which the data used to calculate the quality rating was produced. The second notice provides information on quality ratings validation. Scrolling down, we also see that no numeric ratings are shown for Prime Health. Under our proposed definitions in 438-500, a quality rating means the numeric or other value of a quality measure or an assigned indicator that data for the measure is not available. In our prototype, Prime Health covers children and adolescents under age 18, and this page includes only quality ratings for adult measures. So instead, there is an explanation that Prime Health does not cover the population being measured. Let's go back to the landing page and explore the buttons that provide the user with quality ratings for mandatory measures stratified by sex, race, ethnicity, and age. Using these buttons, users can view quality ratings representing services provided only to plan beneficiaries that align with the participant selected factor of race, sex, ethnicity, or age. By clicking on the Measures by Sex of Plan Enrollees button, an example of a quality rating calculated by the state for each managed care plan stratified by sex can be seen. Similarly, clicking the Measure by Race and Ethnicity of Plan Enrollees button from the landing page shows an example of a quality rating calculated by the state for each managed care plan stratified by race and ethnicity. And finally, clicking the Measure by Dual Eligibility for Medicare and Medicaid button from the landing page shows an example of a quality rating calculated by the state for each managed care plan stratified by dual eligibility status. Finally, we return to the landing page and scroll down to Step 5, Enroll in a Plan. Here, the user can click on a hyperlink that will direct them to resources on how and where to enroll in a Medicaid or CHIP plan. The toll-free telephone number is displayed again in case the user needs live assistance to select a plan. This concludes the demonstration of Prototype A for the Medicaid and CHIP quality rating system. We encourage you to use the comment period to provide any feedback to CMS on these proposals and view Prototype B and the associated demonstration, which represents what would be required by the second phase of implementation. Additionally, there is a citation map on the QRS website that can help map prototype features to the proposed regulations. You will find these resources and instructions on how to provide comment on our proposed regulations on the MAC QRS website on Medicaid.gov.